The European School of Oncology supported 11 journalists from 9 countries to attend the European Cancer Congress in Vienna in September. Afterwards, we asked some of the journalists to tell us what they would take away with them and what they had learnt.
Cancer is quite a problematic disease in Latvia because we have, comparable to other countries, we have low survival rates, and one of the main problems were diagnosing too late stages of the cancer. So we have now started several screening programs which can find out the cancer in earlier stage, and our dates are coming up slowly. When I'm going back, I'm planning to cover this theme about low survival rates in our country, comparing to not only to other European countries but also to our neighboring countries. But I'm also hoping to make a separate supplemental issue to our journal, which is Popular Science magazine, Illustrated Science, and this whole issue would be devoted to cancer. Yeah, I think this conference and especially our working sessions will help.
I would say that for my audience, for the health policy journal readers, what is more important is that there are disparities in Europe, and that Romania was given for several times as a bad example. It was said that 75% of the Romanians who need radiotherapy don't have access to it, and it's all true. And of course, access to new medicines. I'm definitely going to write about these disparities. It makes a big difference to come to the European Cancer Congress because you can speak to specialists, to physicians, and people who are specialized in health economics, who can explain you better the concept. I'm really sure that a lot of journalists, as myself, need explanations.
I think I learned a lot about research in cancer, about the new models of research and the main debates that are going on at the moment. I also learned quite a lot about the health economics of cancer, the discussions about the affordability of the new drugs and technologies, and also about how different cancer priorities compete in order to get the attention and the money. You cannot do anything except if you have a good tool of measuring things, of measuring the value of a certain drug, of measuring the number of patients that would benefit from that drug. I think that it's all about the numbers. The conversation about the whole process of health technology assessment is only just beginning to happen in Romania, and with a lot of things happening behind closed doors. So I think that the first story I'm going to work on is going to be that how affordable are drugs, are the new innovative drugs in cancers in a Romanian context.
Maybe there are like two different parts in this Congress. One part is like the more scientific field, in which most of the themes have been focused on recent research, like obviously immunotherapy in cancer, but also economic problems that are with the new drugs, and also inequalities in the access to healthcare.
I think the big theme that's really come out of this conference this year is cost. So over the last 5 years there's been a lot of discussion about how cancer is no longer a single thing. There's no such thing as breast cancer or colon cancer or brain cancer. Each of these cancers is lots of different things, and to be able to treat them we need to see patients as individuals. The big issue that's coming up now is how on earth do you pay for such personalised treatments? And so now I need, as a journalist, to find some way of actually delving into these issues of cost and affordability. I think it makes a massive difference coming to an actual event like the European Cancer Congress, because often it's not the sessions you attend that are the things that generate the big stories. It's often the conversations you have outside the sessions that generate those ideas and get you thinking about things. I think the organisers of the journalism programme have actually had some really, really good speakers who I think I'll be approaching both of them for comments and to carry on the discussions we've been having in the meeting room.
One of the surprising things I've learned here is how skeptical you have to be of the clinical trials. That was a real wake-up call for me. I think the challenge in covering cancer in the Danish media is to avoid writing stories like here are 10 good vegetables to eat for preventing cancer. Just making these lists, and they are a hit on the internet. You have a lot of readers, but you don't have the necessary evidence. You don't put it in a bigger context, and you need powerful argument as a journalist to stand up against your editor and saying this is not the best story on cancer we could do.